Take it this way.
This is where Myra Torres often found herself, standing on the sidelines watching instead of playing with her children. Sinus problems kept this avid soccer player and mother of two out of the game.
You don't get sleep at night. It's horrible because you can't breathe through your nose.
It is a miserable way to live. Chronic sinusitis can have debilitating symptoms, including facial pain and pressure, nasal blockage, loss of smell, headaches, and fatigue. Dr. Keith Clark is an ear, nose, and throat specialist.
They have pain in their teeth, sometimes just all across their face or even across their whole head. They really do feel miserable. And when you can't breathe through your nose, you feel miserable. And
But now, Dr. Clark and his partner, Dr. Troy Major, are offering patients new hope with a revolutionary procedure that is so minimally invasive it can be done in a doctor's office. It's called balloon sinuplasty, a far different procedure from the conventional surgery patients have long feared.
That is the stereotype, the roto-rooter with packing being the most painful thing coming out later, but that scares people to death.
Myra was scared until she learned this.
We give a little Valium just to make them relaxed and talk them through it, local anesthetic and topical anesthetic, and that they tolerate very well.
It was the peace of mind Myra needed to undergo the procedure.
It's kind of a routine now. Like I've had an infection every 3 months, constantly.
During her consultation, Myra shared her symptoms and underwent a CAT scan taken right in the office that shows doctors exactly what needs to be done. These x-rays show how narrow Myra's sinus passages are. That blocks drainage and causes infections. The sinuplasty procedure is about to change that. This animation shows how a balloon catheter is placed in the sinus and gently inflated. When the system is deflated, a larger permanent opening remains, restoring normal sinus drainage and function.
There could be some pressure here.
This monitor shows the balloon being inflated in Myra's sinus.
You're just doing wonderful.
Listen to how well she's tolerating the procedure.
How was that, Myra?
That wasn't bad.
And Myra will have less discomfort after surgery because Dr. Major is not cutting tissue. Instead, he is gently moving bones around to change the shape of Myra's sinus outflow tract.
What I loved the most was that the doctor was telling me step by step what to expect. So that definitely made it easier and more comfortable for me.
So far, more than 95% of patients describe incredible results.
And then when they come back after surgery, you can see almost the twinkle in their eye. Wow, I feel so much better. I don't have all that drainage.
It was everything Myra had hoped for.
And 2 days, I felt great. I mean, I felt like I have not felt in years. I was back to normal.
And back on the soccer field with her family, where she belongs.
I can go on with my daily life like I was years ago, and now I'm back to normal again, and I'm very happy.